It's really great to be with everybody. It is week 14 since we started, and this virus is literally marching across the world. We're seeing shifting patterns, but the one thing that's not shifting are the numbers. Well, they're shifting, but they're shifting in a bad way. It was similar to the Columbia study. The Columbia study said that if we had begun social distancing a week earlier, we would have saved a lot of lives. This study said that if we did not do any social distancing throughout the world, we'd have over 62 million people dead and 530 million people infected. In the United States, that would translate to about 4.8 million dead, as opposed to 113,000. So it seems there's no mistaking that social distancing has definitely worked. As things are cooling down a little bit in Europe and over here, we're seeing a new hotspot in Central America, South America, and Southern Asia. New Zealand actually has no new cases for over 15 days. It's amazing. Not one infection in New Zealand, nothing in 15 days. I think we all are really waiting for the other shoe to drop, the second wave, so to speak. And I think a lot of us were concerned by the images we saw from people on beaches, Memorial Day weekend, and all of the protests, people really close in proximity with each other, not practicing social distancing, shouting where their respiratory droplets would travel further. Very, very concerning. There was a very interesting poll. Well, this week also, there was a little controversy over a statement. There was a little difference in vocabularies. Someone came out, a WHO representative came out and said that asymptomatic patients are very low likelihood to spread the disease. But asymptomatic patients versus pre-symptomatic patients, there was a semantic difference between the two. Ultimately, the bottom line is we still wear our masks and practice spatial distancing, social distancing. There was a CNN poll that they do monthly, and it was very interesting in that there's more optimism that we are turning the corner. 49% of people said they're willing to go to work this month, as opposed to 41% last month. But what was really interesting is this polarization that we see in so many aspects of our society today. Though when you analyze those 49% of people that said they're willing to go to work, 73% were Republican, 23% identified as Democrats. On the scientific front, Celine's going to give us an update, but we're going to see a lot of different developments taking place. I mean, nothing seems to be happening, but everything seems to be happening. In terms of genetics, analysis of genes, this is something that some of us have talked about. We're seeing that having type A blood seems to be a risk factor, and you're 50% more likely to require oxygen or mechanical ventilation. So my question for Celine, she can answer it later, is this going to be a comorbidity? Do we think of this like we think of obesity and hypertension and heart failure? JAMA came out with an article, again, going along with this drumbeat of more good news about convalescent antibody, seeming promising. Regeneron announced they're going to begin studies this week on their monoclonal antibody treatments. The issues of vaccine, it's not, are we going to have a vaccine? It's like, okay, when the vaccine comes, how are we going to allocate this equitably to all peoples? Who's going to get it? Who's not going to get it? And there's a lot of ethical discussions going on about that. There's also discussions about remdesivir. I know Greg Borazian has mentioned how hard it is to get. The supplies will probably run out by late June, and there's a question of whether it will be replenished in time, certainly by August, September, but there might be an interval where remdesivir is really hard to come by if you really need it. And then another question that was interesting and Celine can address is how come all of these randomized clinical trials, of which there are hundreds and hundreds, really don't focus on children? The first study is now being announced by the National Institute of Health, but really children have been overlooked. So that's a quick overview around the world. Kim is going to join us later, but Dr. Kojaglanian, a professor of infectious diseases and pediatrics, will be talking next.
Good to see everyone again. Larry, I think you summed up everything pretty well. I will take on where you left off about children. So really, children haven't been left out. It's just that, as we have said over the past several weeks, that children luckily are affected much, much less by this disease. So the burden of disease in children is very low. Just to give you an example, out of the 2 million cases in the United States, only 5% are children. And therefore, we do know that they are not the bulk of the severe disease. But of course, we still don't know how much of them are in the community with mild disease or pre-symptomatic or asymptomatic, as you said, Larry, and how much they're contributing to transmission, because that's going to be key for school openings in the fall, to see that if kids, yes, they don't get hospitalized, do they transmit disease? So that's obviously a question to be answered. And of course, as you guys all know, we're also very heavily invested in the rare but severe MISC, multi-inflammatory syndrome in children. And every week, if not twice a week, we have conferences about that, gathering data and following these kids. Just like adults, I'm sure some of you have heard, a subset of patients, it's taking months and months and months for them to recover from COVID-19. So we are also worried about these subset of kids who are presenting with severe disease, what they're going to be their long-term prognosis. So a lot of us are working on that as well. I just wanted to also, Larry, mention that I think we left out that there is hotspots right now in the US as well, not just in Latin America. So Florida, Arizona, Texas, and if I'm not mistaken, Arkansas and North Carolina are seeing significant increases in their numbers right now. Obviously, there's many explanations to that, whether the Memorial Day gatherings, plus more testing, plus a loosening of social distancing altogether playing a role. So I think today really, I'm not going to focus on my scientific stuff. I'm just going to really more focus on the public health measures that we really should not be forgetting. I feel it is disappointing to me as a citizen that we don't see much of this on the news, where there is some guidance as to how people are supposed to get back to work. I mean, they basically refer you to the website of the DOH of each state. I don't think the general citizen knows necessarily how to navigate these websites. So I'm hoping that each business that opens, no matter how big or how small, are really following scientific guidelines and not just their own, made up guidelines for us to be safe in this reopening phase. Because as Larry said, this virus is still here. We were hoping that in the summer things would calm down, but that doesn't look like it. And again, let's remember, this is a brand new virus. None of us have underlying immunity to it. And therefore we are all prone to get infected one way or another, whether mild or severe. And so that's what I wanted to mention about traveling. I know a lot of people are excited to travel. There is good deals on the airplanes, but as an infectious disease consultant, I would really urge everyone that if you don't have to travel, don't. Obviously, if you have something urgent, go. But within states traveling at this point, again, even though we are better now, but if we travel, let's say, to any of these southern states, we might again exchange the disease. That's where I'm going to stop, Larry, and take questions. And I know we have a lot of conversations happening later today.
We had a long discussion today at our weekly rounds about opening up our bone unit. I just want to get your thought about this question about disclosure to patients. We're at a big medical center as you are. We have a lot of COVID. On our floor where we see patients, there is an infectious disease group. The head of our infectious disease group is running studies on those who have had COVID-19, but presumably are cured and have antibodies. But on that same floor, not the medical center, but on our floor, we have patients coming in for research. So the ethical or legal or medical question was, to what extent should we disclose this information as we open up?
I would say at this point, I don't think, and this is only my personal opinion, that there is necessarily any disclosure necessary, because all of these patients that you mentioned are coming post-COVID, post-recovery, and they're not really supposed to be contagious at all. So, you know, to create fear or to create an unnecessary anxiety, really with no basis, I don't think is going to do anyone any good. Hopefully, again, people are screened every time they're entering for acute symptoms, so that people who do have acute illness, respiratory illness, should still be isolated and, you know, taken care of appropriately. But I don't believe there is a need for that. We're going to have our own MISC clinic, subspecialty clinic, multidisciplinary clinic, to follow these kids with similar, you know, illness that had COVID, and we're not going to be giving them a separate floor or not seeing them with other clinics when we have, for example, other endocrinologists who run their clinic on the same day.
We're going to move on to our presentation today, and we are really blessed in the Armenian community to have so many philanthropies engaged throughout the world. And even though they're talking about Beirut, Lebanon, their focus is in a lot of different areas. But their focus is on helping people, helping Armenians throughout the world. But today we're going to focus on Beirut. And this is just an amazing group of people. And it really is a pleasure. I'll just mention their names. And they're going to be speaking about how COVID-19 is impacting their activities in Beirut, Lebanon. The numbers in Beirut don't seem to be too bad. There are 1,400 cases as of today and 31 deaths. But the reason for bringing them on is when I was speaking with them, it seemed as if the impact of COVID, on top of all the other problems in Beirut, which they'll familiarize ourselves with, this is just the tipping point, and it's a straw that broke the camel's back. So I'm going to mention their names, and then we'll invite them to speak, not all at once. Karen Papazian is representing the AGBU. We've known Karen for many years. She's been very involved in our healthcare programs and our meetings that we have once a year in the Healthcare Summit. Irina Lazarian has done a fantastic job, first at Armenia Fund, where she helped develop Highbridge Telehealth, and now as Executive Director of the Karagoshin Foundation, which is a philanthropy that really practices inconspicuous philanthropy. You don't know they're there, but they've done a great deal of work for many, many decades. Very honored to have Zaven Kanjan with us, Executive Director of the AMAA, an advisor, man of wisdom, great speaker. Thank you so much for all you do. Talin Daglian, who is a nurse by training and are representing the Armenian Relief Society. And Alyssa Manasyan, who'll be joining us a little bit later. She's on another call, the Executive Director of the Janishyan Foundation. So why don't we start with Mr. Kanjan and hear about the AMAA and your activities taking place in Beirut, Lebanon, and some of the problems you're experiencing.
Well, glad to be here again and tackle this subject, which is tangential to the COVID-19. As you just mentioned, Larry, the coronavirus hasn't done much damage to Lebanon, but the Lebanese and many others from outside have done a lot of damage to Lebanon over time, over decades, and today as well. As I speak, it's Friday morning in Lebanon, and if you haven't heard the news, Thursday was a very volatile day. There were protests. Protests have erupted again all over Lebanon. The roads have been closed. The barricades have been raised. It's a mess again. These are, and most importantly, also the dollar has, the local currency has plummeted. The official rate of the US dollars being 1,500 Lebanese pounds to the dollar. Now it's around 7,000 Lebanese pounds in the market. You can imagine what the purchasing power of this currency is for the people. At the outset, I would like to say that there is approximately, I think the World Bank or IMF has mentioned that there will be very soon 50% poverty level in Lebanon. And even now, the situation is very tragic. To say a word about Lebanon in the past, I'd just like to say that Lebanon was and has been the throbbing heart of the Armenian diaspora for many, many decades, together with Aleppo, Syria, and the other regions in the Near East. That has considerably changed, but still after the civil war, Lebanon recovered, and our institutions, our communities, our denominations, our churches, education institutions were doing fine. Now, a rare mirror perspective since October 2019, so that you have a perspective of what has been happening in Lebanon over the past 9 months, maybe 8-9 months. It all started with political upheaval in October, and people ran to the streets, demonstrating, especially protesting against corruption in the country. And I guess maybe there were already signs of the local currency losing value, of inflation, and so on. So that continued on for many months. And it disrupted life, disrupted educational life, it disrupted businesses. So there were layoffs, bankruptcies, schools were closed, people could not take care of their children, people did not have, were cut off income, and so they could not afford paying tuitions. So within all this status or crisis, another crisis erupted, which was very closely linked to what was happening there. And that is the liquidity crunch. Lebanese who had been working all their life and who had saving accounts in banks suddenly found themselves unable to withdraw their own money from the banks. Outside organizations, philanthropic organizations like the AMA and others, who transmit budget funds in US dollars, were frozen in the banks. And our recipients, our institutions could not withdraw those dollars and transmittals. So that certainly, of course, made things worse, exasperated the situation. And then number 3 came the COVID-19. So you can imagine how things developed and what the condition of the socio-economic condition of the people has been, and is deteriorating. To give you 3 examples, that was the experience of the Social Action Committee of the Union of Armenian Evangelical Churches, AMA-related organization in the Near East, are the following that was reported to us. A young mother, aged 33, had a 2.5-year-old autistic son, and has not been able to provide milk for her son, and was feeding him sugar and water to quench his hunger and make him sleep at night. Another example is of a man who ran into the office crying. This man had 4 children aged 3 to 12, and cried and stated that they had been starving and haven't eaten for 2 days, and begged for basic food and basic bread, actually. And the example number 3 is a young diabetic male who has not been taking his medications because he has been unemployed and cannot afford the medicines, which certainly are expensive and certainly have been more and more even unreachable for ordinary people. These are the heartbreaking examples, and this is just the tip of the iceberg. I'm sure there are hundreds and hundreds. There were even examples, unfortunate examples of suicides reported, even in the earlier stages. And this certainly have, again, exasperated the situation now. Now, what now? What is the situation now? All this has created all this unemployment, poverty, inability to sustain and support themselves. Well, luckily, the good news within this picture is that I guess probably around 4 weeks ago, maybe, the banks, guided by the Central Bank of Lebanon, suddenly had the permission to let account holders withdraw fresh currency, quote unquote, fresh transmitters, fresh dollars. So when we transmitted new amounts of budgetary assistance to these institutions, they were able to withdraw, while the old accounts are still frozen. So that was good news, of course, and it went on a little bit, giving them a little bit of room to breathe, and they were able to withdraw dollars, the transmitters in US dollars, exchange them on the market at 4,000 Lebanese pounds, and meet the liabilities and the obligations of these institutions. The MA has a lot of institutions that we support in Lebanon. First of all, the churches. There are around 10, 11 churches in Lebanon. There are 5 schools and 1 boarding school in Ain Jar. There's the Haigazian University, the only Armenian institution of higher learning in the diaspora. And then there are other institutions which are managed through denominational partnerships like the old age home and others. So it has not been easy. We can say, and we have been saying, I guess, for some time, that the virus and its effect, and then all the effect of all these things that I mentioned, are not going to define us, to define who we are. We are better. History reminds us that we've seen more tragedies, have bounced back, have survived. We are resilient, buoyant, and tough, and all these are true. Certainly, we have a long history, and many of those we have passed through. However, it should be very clear that we cannot take things lightly in what is happening in Lebanon today. The situation is really extremely serious. It is an existential crisis in Lebanon that our communities are going through, and that we should not ignore and overlook, but be vigilant. First of all, educate ourselves as a diaspora, big diaspora community in the United States, be vigilant about it and ready to emulate Christ as he taught us on earth, to collectively mobilize our efforts and reach out in helping our community in Lebanon. Syria is not different, but still the focus is on Lebanon, because this 4th phase of trouble that I mentioned could develop into violence, and we don't want to see what Lebanon went through in the 70s and the 80s. So this is a cry for mobilization and reaching out to the communities in Lebanon.
Very good overview. It's amazing to me how much how much Beirut has changed over the decades. When I was growing up, people from Beirut have made so many significant contributions to American culture. And Beirut was known as a bastion of surgical training and the financial center of the Middle East. How could something like this happen to such a lovely place, and now it's so devastating?
Well, certainly we don't want to go into politics, but there are internal domestic causes and reasons, and there are neighborly and external reasons and causes. Even in the 70s and the 80s, the crisis and the civil war that Lebanon went through was not purely domestic. Lebanon is a small country of 3.5 million people, and the freedom that this country enjoyed for many decades since it took independence from the French in the 1940s has been a bastion of interference and of foreign meddling, and that has caused a lot of what we have seen and we are seeing today.
Do you see your organization increasing aid to Beirut, or are you just keeping it steady at this point?
Undoubtedly. We have, first of all, we have rushed our regular budgetary assistance and transmitted them much earlier than our regular timing. That's number one. And number two, we have, reached out and transmitted emergency funds to take care of the socioeconomic problems in the community, in the general community of Lebanon. And now we are about to deal with another situation, and that is the schools. All of our schools have certainly deficits under the conditions that I described. And we are again in the phase of making arrangements to reach out and send emergency additional assistance, significant assistance to meet the deficits of the schools, pay the payroll of faculty and staff, even though these payroll transmittals are going to be paid at the rate of 1,500 Lebanese pounds, which is the contract of employees all over Lebanon right now. While you can imagine if the dollar has, the currency has plummeted to a rate of 7,000 to 1, you can imagine the trouble of these people going to the supermarket to buy anything that is needed. Yes, and they are considering much more even under the circumstances, reaching out not only to Lebanon, but also to Syria as well. And I want to share another good news with everybody who's interested, that after 18 months of falling under the US sanctions, the AMA was unable to transmit any funds to Syria. After a very hard fight, we finally, in March of 2020, we obtained formal and official license from the US Treasury, and since then are able to transmit funds to Syria and Iran through our institutions in Lebanon. So that was a good news, at least, which helped alleviate some of the pressure in Syria.
Zaven, what is the situation of the Syrian Armenians that moved to Lebanon during the war?
They're still there. I can say that 25% of those receiving aid from our social centers are Syrian Armenians. So there are still a chunk of the Syrian Armenian immigrants, refugees who are in Lebanon, who are still stuck there, unable to go anywhere. And their children go to our schools, to many other schools, the other schools of, whether it's AGBU, the Prelacy, the Catholico State, of course, Catholic schools and so on. Many Syrian children go to their schools. We fund their tuitions, and they receive sustenance and support to aid them economically.
That's great.
Crisis brings people together when there's a common goal. We see this during the earthquake and other situations throughout the world. It's amazing how much all of the philanthropies do in Beirut that are with us today. Is there any coordination amongst the ARS, Genetian, AGBU, Karagoshin Foundation, and the AMAA.
Is that question to me, Larry?
It's a general question to the panel. Anyone can take the question.
Probably there is knowledge and information that is shared amongst some, but there is nothing like the Syrian Armenian Relief Fund, which was created in 2012 in Los Angeles, in California, where we centralized all the aid that went to Syria. No, I think each of these institutions is doing a blessed work individually. And the key to your question stems from what goes on in Lebanon. If Lebanon, these institutions, the recipients, our community over there forge some kind of a unified front, then certainly we can mirror that. But right now, every institution in general is trying to help others as well, but they are independently operating.
Well, thank you. Are there any other questions? Great. So we're also very, very happy to have Karen Papazian with us from the AGBU. Karen, can you tell us a little bit about what the AGBU is doing in Beirut and the impact of coronavirus on your programs?
Thank you, Dr. Najarian, and thank you to you, Dr. Najarian, but also all of APO's team for inviting AGBU to be part of this, but also for all your guidance over the last few months. Mr. Khanjan gave a wonderful sort of picture of the landscape. As we all know, AGBU's long history has sort of had us experience so many turbulent times, and through them we've always been there to assist and aid, and it's no different today with the global pandemic, and a lot of our global efforts do focus on the Armenians living in Lebanon. Pre-COVID days, AGBU ran vast programs in Lebanon, schools, youth programs, scholarship programs. However, today things look a little different. Our center is closed. Most of our programs have been suspended. But even before the pandemic hit, the AGBU Lebanon office, led by a number of incredible staff members as well as a team of volunteers, had launched a food distribution program. And that was really in response to the country's dire economic situation. So in February, we had launched the program. We had about 100 food boxes. So these were free food boxes to provide monthly provisions per family. Very quickly, by the end of March, we had increased that to 150 families. And then as the country grappled with COVID, the economic crisis, as well as the chaos with the peaceful and violent protests, we kept seeing the number of families in need grow. In early April, it doubled, and we've peaked at 500 families now in May. These families are coming from all over, from Beirut, Mount Lebanon, Baca, and these are not just AGBU members. 40% of the families that we're serving are non-AGBU members. And thanks to the churches, we've been able to identify the most vulnerable families, and we've had that opportunity to meet as much need as possible. We've seen, unfortunately, how fragile the family's economic situation has become, and it is truly heartbreaking, but we're committed to supporting the needs of the Armenians in Lebanon, and many of our humanitarian aid programs have continued. Our dispensaries are still continuing to give low cost. AGBU subsidizes medications for non-Armenians as well as Armenians, so that's continued throughout the pandemic. any of our school children whose families couldn't afford tuition were offered financial assistance. Then, of course, we've tried to keep up the semblance of real life with the lockdowns and with the economic crisis. Our schools were closed. However, we were able to immediately move to a remote learning program, thanks to the diligence of our teachers, but also a number of our classes had already in the last couple of years incorporated some online learning elements. So it was a easy and quick transition. We've expected or we anticipate there will be great need for quite a while, and are continuing to assess the needs of the community. And these kind of discussions are really important to see also what other organizations are doing and where the gaps continue to remain. And so I'm very interested to hear, of course, what everyone else is doing. Generally, I just want to also say I'm grateful that there are other organizations that are doing work in Lebanon, and together we are providing the support and assistance that the Armenian community needs in order to get out of this and to find hope tomorrow.
That's wonderful. A question for all of the groups working in Lebanon. First, historically, after the previous challenges Beirut has faced, or Lebanon has faced, what has happened to the Armenian population there? Have we been seeing a emigration of Armenians from Lebanon to other areas? And if so, do you anticipate the Armenian population shrinking further from the current crisis, which really sounds it's affecting all parts of their lives?
Now we can go as far back as to the 70s. The nearest, of course, was the most populated area in the diaspora of Armenians as a result of the genocide survivors who took refuge in the neighboring countries. In the 70s, the Armenian population numbers dropped tremendously in Lebanon, bringing down from hundreds of thousands to under 100,000. Currently, I don't know what the number is. There is mention of 40, 50,000, maybe up to 60,000 Armenians. But I can say that, yes, we feel tangibly, we feel an exodus from Lebanon in the past several years, which I think was a result of the Syrian war and Syrian crisis. There has been some movement to Armenia, which is a blessing, which is good. There aren't too many other places for them to go. Yes, we don't want to talk much about it, but because we're grateful to the Middle Eastern countries, they have been good and a blessing to us. But I think there is a necessity to assist and help all those community members who voluntarily decide to move.
We have a general question directed to Dr. Kojaglanian, who may not be able to answer this, but the question was, how bad is COVID in Lebanon at this time? The numbers say only 1,400 cases, but what we've learned from the start of this call, there was maybe 800 cases in the United States 14 weeks ago, and now we have 2 million. So is Lebanon on an accelerating phase? Is it on a neutral phase? And in the face of so much social disorder, how can they practice social distancing? So maybe Dr. Akimian or Dr. Kojaglanian can respond to that.
So I think what Lebanon did right in the beginning, Larry, is that they closed really early on. So the schools closed way before we closed in New York and New Jersey, about 10 days, if I'm not mistaken, earlier. So that's why in the beginning, in March and April, I think they were in very good shape COVID-wise. But just like Mr. Zaven and Karen mentioned, the economic crisis was so bad that staying home obviously accentuated that crisis to exponential levels. But COVID-wise, number-wise, they were able to control because they closed early. Now, they have eased the lockdown in the past 2 weeks, and actually they have seen an increase in the number of cases in the past 2 weeks since they eased the lockdown. And just like, you know, certain places here, or like we've heard in Armenia, many people are not following the wearing masks or the social distancing. So we do anticipate that it could get worse if, you know, there is not attention being placed on phased opening. However, I must say, for example, now, if you are not wearing a mask, if you go to a public place, you could get a ticket, you could get a fine. So they are able to gauge a little bit better than, let's say, Armenia as an example in that sense, but I could be wrong in. The other place how they're getting diseases also is hotspots of people coming in. So for the whole 3 months, a lot of expats who were living abroad wanted to come, and since they cannot go to work anyway, they wanted to basically be in Beirut. So they allowed a lot of Lebanese citizens to come in. And for those people, there was no hotel or quarantining. It was just voluntary quarantining. And those created definite hotspots where you know that people are not going to voluntarily quarantine. So that person who would arrive from abroad would infect the whole family or the whole building or the whole neighborhood. So I am as surprised as you that they were able to control it well. I was more worried that there might be transparency issues, that there are more cases than there are leading on. But I have obviously my colleagues and some of my classmates who stayed there are in top positions in the country, and they are reassuring me that the numbers are actually true, that they are testing, they have a lot of capability to test, and they're testing, but they're not finding that many. But as you said, and as I just mentioned, since the lockdown has been eased, for example, just this week, my sister has a birthday party she's invited to take her kids to, and I'm going crazy, but she's going to take them. There's 20 people who are going to be in a closed space. So I told her, you cannot go see my parents for 10 days after that. If you're going to go to the birthday because your kids are, you know, enclosed in the house for 3 months, then you have to give something else up. You cannot see my parents for 10 days because we don't know when the next case is going to be. And other activities like, you know, taekwondo, dance, gymnastics, the activities the kids were in have started to open up. So, and there is rumors that the airport is going to open up to Europe regularly for tourism in July. So I think they're able to gauge it a little bit better than other places, but if they don't pay attention and they just let it go, then there is definitely risk of acceleration. Definitely, it's not there yet.
With all of the social and economic unrest, you mentioned tourism is going to open up again. Is this a safe place to visit?
So tourism, by tourism, I mean expats like me who want to go spend the summer there. You don't understand how busy the summers get in Lebanon. Everyone who lives abroad comes in there. You cannot find tickets in July and August to go to Lebanon. So that's what I meant mostly. As far as other like Europeans or other people to visit Lebanon, lately it hasn't, you know, attracted much because of the social and economic turmoil, unfortunately. But people like me who would go would think twice about going at this point.
We're now going to go to the Karagosian Foundation, which practices inconspicuous philanthropy.
Actually, thank you for inviting me to speak on this subject. I want to confirm whatever Zaven Khanjan mentioned, the whole background of problems in Lebanon, including currency and poverty and political situation. Within that, in that platform, I want to share what Karagosian Foundation is doing. We have 3 centers in Lebanon. It's in Burchamut, Fanar, and Anjar. And mostly we are outreaching into different areas in medical field and in social field. In medical field, we became primary healthcare center accredited by the government of Lebanon. And we accept everyone in that for medical purposes. We have full scale of medical projects, medical assistance in different kind of area of healthcare. And we receive a lot of medical help and financial help from international community, from Ministry of Health. But still, the situation is very dire, and with all this stuff are going on, it might become very difficult to continue our efforts to the same, in the same scale of things. And I have a few things to mention that the chronic diseases for people are going to be really difficult to handle because of COVID, because of political situation. As you know, that's the same in the US. People with serious chronic diseases, they were not able to get their regular help. They were not able to get their regular medication checkup, etc. So they kind of are being pushed on the back, on the back plan for that. And mostly people using those services were refugees, Syrian Armenians that after Syrian crisis came to Lebanon, and they were kind of getting a lot of assistance from us. So medication is going to be in shortage, at some point if this situation continues. Currency is also a big issue, but we kind of managed to work through the system, through wire transfer and stuff. The cash was an issue, but also the medical community and international agencies are really supporting financially and with medication from Ministry of Health. One thing that has not been mentioned here, the Ministry of Health organizes bi-weekly meetings to guide all those accredited organizations in the medical field for the next step. And then that started with COVID. So we did not have any single case in our primary healthcare center. We had suspects that every person who enters the place, they're being checked for the, temperature and that kind of thing. And any suspect will be isolated immediately, sent to the hospital. So we really had a lot of suspects, but not a single confirmed case inside the organization. That was managed really, really well. We did not close during COVID. We continued our operation, maybe just the first or second day, like for a couple of days only. But in general, we continued our programs with a shorter staff, but we were able to go through this COVID without closing. But all those problems that exist now, they are kind of taking domino effect and affecting other parts of social life. And financial crisis, of course, it brings other issues that were at some point they existed there, but now they're being escalated. And that is, drug addiction, people out of job, the rent payment is an issue. So all this stuff will become a burden on our Armenian community, on Armenian charities. And we do all we can. But the coordination, like you mentioned, is going to be a big deal to kind of, to make it efficient. Because this is not the time when we can throw our dollars and say, I'll do my job and you do yours. We have to really come together and make all our funding going and efforts and proficiency really coordinated and very efficient, on the ground. I can't say that much.
So are you advocating for something like the Syrian relief that Zaved helped organize many years ago?
I'm not suggesting to create another level of coordination, but maybe it can be discussed as to who is really focusing, because there are certain areas and there are needs in every area. Maybe we'll just allocate our efforts. Each organization should take the lead, or, in that coordination process to have really to direct their efforts in a specific field when they feel very strongly, when they have strong expertise, when they have a lot of knowledge and they have a lot of experience. I think that's how it should be coordinated. I'm not suggesting to create another umbrella organization to coordinate this. That's what I feel like it.
Are there any thoughts about what Irina said? everybody's thinking.
Well, it's not going to happen now, but it's a good way to think about it, because the work is going on in the field. Nothing is stopped. It's difficult. It's more difficult. We are taking more efforts. We are increasing our budgets. We are doing some extra work. But I think down the line, it will be something to be really seriously considered.
To confirm partially what Irina is saying, is that the AMA and the Armenian Evangelical community, both in Lebanon and Syria, has very close cooperation and relationship with the Karagosian Foundation, with the Junichi Foundation. And so, you know, many of these organizations are interrelated, intertwined there. The leadership is same and so on. So there is already that kind of coordination and cooperation. It's very helpful and blessed.
Right. And one more thing I wanted to add, Zaven, you mentioned that the population is between 40, 50,000, and something that is very hard to actually state accurately. We all know for the reasons, but I actually came up with another number for population, people who really need our help and really come to our centers. And that's the population we will be interested in, you know, because if there are 50,000 people and 10,000 are not interested or needed our help, that's not something that we need to focus. I think the number of people that are coming, the number of people that are getting different kind of services, and that's the population, not demographic population, but population that needs our assistance. I think that's what we need to focus on.
Yeah, to add to that, we should mention that the middle class in Lebanon is disappearing, and they're moving down to being in the poverty level. And so the numbers that you are defining and describing are increasing.
Exactly. Not because population is being not counted correctly, but because they're dropping below poverty line, losing jobs, losing rent. So all kind of social and financial issues are impacting that middle class in the first place. Because the richer people, they kind of have their cushion, and they kind of not crossing that line in a way. But the middle class is very vulnerable at this point.
And I was intrigued by what Karen Papazian and Irina said about purchasing medicine. Purchasing medicines is always tricky. We try to do it for medical missions. How do you go about purchasing medicine? Do you have relationships with drug companies, or do you just through donations from companies, or do you actually buy it on the open market?
Well, for our perspective, I can say that we get assistance because we are accredited primary healthcare center. We get medication from Ministry of Health of Lebanon through different agencies that operate in the region, and that will be US and UN family of affiliates, YMCA and other agencies that technically donate medication. Last year, we registered about 700,000 worth medication coming to our center. So medication, we purchase some that is, you know, like is kind of a gap that is not being donated, but majority of stuff that we need is being donated in the form of medication.
Thank you very much, Irina. We appreciate everything that you do, not only in Lebanon, but elsewhere as well. Let's go to
Thank you for having me.
Talene Daghlian from the Armenian Relief Society. You have a long role in Lebanon. Can you give us a little history of what you're doing there and how COVID is impacting on your programs?
Sure. Okay. Before I start, I would like to thank you, Larry, for inviting me, and to Kim that introduced me to APO, and I have been able to attend all your town meetings, almost every one of them. And it's been very educational and very helpful to myself and to my community, to my organization. I'm sure all of you know Armenian Relief Society. We mostly are called ARS or HOME. And we are in 27 countries, and one of them is Lebanon, which we are going to focus today about that. Lebanon, it's not called as Armenian Relief Society, it's Armenian Red Cross or LOH, Lipanani Okuntian Khach, and they're 90 years old, the Armenian Relief Society is 110 years old, but they were established 20 years later. And they have more than 3,000 members and 26 chapters. And as Mr. Khanjian and Karen and Irna said, the situation in Lebanon, all of us know, I don't want to repeat everything that was said. It has affected Armenian Relief Society and especially the Armenian Relief Society in Lebanon and their work. It started, like when 2020 started, it was really a bad year because of the economic and political situation. And mid-March, the coronavirus started. Even if the cases were low, but as everybody, all the panel said, it was affecting everybody. The only thing I'm going to say different than what the other panel said, my members in Lebanon informed us that they have a task force with all the organizations, with the Health Ministry of Lebanon, with all the churches, AMAA, the Armenian Presbyterian, the Catholic, the Palace, the Diocese, everybody together. They have a beautiful task force. They started mid-March, and all of them have been working together during the COVID. And ARS mostly is involved in the medical center, which is where they see all the COVID patients, and they are in charge of preparing meals for the elderly and the needy people. Before the COVID, January and February, they were making 200 meals twice a week for those people. After the COVID, they started preparing more than 750 meals twice a week and distributing to the elderly and all the needy people. And they have done a lot of things with the task force. The first, their priority was to do give them knowledge, education to the community, the Armenian community about the COVID. They started making signs and they started distributing, saying, stay home, stay safe, help will reach you. And they had a hotline. Those people who needed help, they could call the hotline and get the information they needed. They distributed a lot of medications, and they disinfected most of the Armenian centers that patients were going in and out, or they had meetings. So a lot of different things the Armenian Relief Society of Lebanon said that they were doing. And ARS was mostly busy with the three centers, three things: the hot meals, the supplies, and the care packages. The supplies were mostly medications, and the care packages were mostly medications and preventative stuff for all the people who couldn't go out shopping. And the supplies they were buying food and other things and distributing to the people who couldn't go shopping, for the elderly. And all this were done by different organizations who were in the task force and with the community, young ARF, Homenet Men, AGBU members. So I don't know if, I hope what they reported to us is true, and they have collected more than 2.5 million Lebanese pounds during this task force to help the elderly, and $65,000. And the Armenian Relief Society, the central executive, got from early March, sent an appeal to all of us, and it's on Facebook, that we have to start doing donations and funds for Lebanon. and we have raising money to send to Lebanon as much as we can. And it's unfortunate situation, as they mentioned. It's not only the Lebanese Armenians. We have the Syrian Armenians there, and there's a lot of issues, unfortunately. So, ARS did 2 shipments to Armenia and Artsakh as well in early March with the help of Armenia Fund and AGBU and other organizations. And they sent medications, thermometers, and masks. What was interesting, the task force of Lebanon has distributed 48,000 masks. So I hope they're using them.
Well, thank you very much. Thank you for your kind comments. Thank you for your participation and all of the good work that you're doing, not only in Lebanon, but all over the world. We're also very blessed to have representation from the Janitian Foundation. Eliza Manassian is going to be speaking to us today. She's the executive director. Thank you so much. You came on early. We're expecting you a little later. That's why you're at the last, but we saved the best for last.
I was from the beginning, Larry, and thank you for inviting. It was very interesting to hear from the speakers, especially from Tallinn, who confirmed this, so to say, better condition in Lebanon, better numbers in Lebanon to me. I was very, well, I couldn't hardly believe the numbers and optimistic situation there, COVID-wise. And I trust my staff there, but that I'm glad I received some confirmation from a professional from the field. I would be happy to shortly introduce operations of Janitian Memorial Foundation in Lebanon. I totally agree with all my predecessors about the economic situation and the crisis. So they were already undergoing this crisis there. And this was very unfortunate additional challenge. Do you hear me?
Yes.
Yeah, I thought that I'm interrupted. So it was unnecessary additional challenge to the country situation and totally devastated economy and the inflation, all what they face now. Let me. Along with the environmental issues, the economic issues. So what in Lebanon and generally in Middle East, in Lebanon, Syria and Jerusalem, our offices were never closed. That was what amazed me the most. In Armenia, office was closed for several weeks. In Istanbul, they sheltered at home. But in those 3 countries, our services were considered as first necessity, and they were never closed. They did take some shifts and they protected some of the employees who were at risk. But thanks God, we never had any anybody infected. We never had any patient coming with high temperature or infection. I mean, it's hard to believe, but this is what it is. So we have operating dispensary there, accepting patients each day with endocrinologists, with cardiologists. We are having medication dispensing service there, operating each day, distributing the meds. There are several activities going on in a clinic, and we do preventative healthcare activities on a weekly basis. We also do social assistance services, again, in medical field. We're covering or part covering hospitalization expenses, medical diagnostic tests, medical assistance to Syrian refugees, as others predecessors said. We do institutional placement and care for patients with special needs. with the social development, with the families, with teenage girls, the school dropouts. We work as an employment office, and we care for the elderly. As I said, we support teenage girls at risk, so to speak, go back to school, graduate, and get self-reliant. Cares for elderly include allowances and different activities. We do also have a housing project, which will end in a few years, which allows people with limited financial means to become homeowners eventually. And we are involved in community development with women committees and volunteer groups in Burçamut. We also work with the Habitat for Humanity to improve the apartments, to renovate the apartments of Armenians in Burçamut. We work for Armenian community, and the clinic is operating for Armenian community only. So if we see general how the operations are spread, about 64% is focused on medical support. This is only in Lebanon, where we focus mainly on medical support, most part of our activities. And this has been prioritized by the local committee and will be prioritized in the future as the demand is growing, as we see. And these are the times of COVID, some of the pictures, happenings, situation is getting really cold there. And this is now the office accepting the patients you see in masks, and they check the temperature, then the patients get in, they make sure they don't have too many people waiting, that there is space between the chairs. This is the couple, so they can sit together. They try to work by phone as much as possible, so people don't spend long time. They provide guidance through phone, so they don't spend too much time in the office and don't get under risk. So, people thought of the ways they added extra tables to make sure there is a distance between them and the clients. And the employees at risk who underwent heart surgeries or have asthma have been properly isolated and led to work by phone mainly. And offices have been, COVID-wise, what was happening in Lebanon was quite satisfactory because offices have been sanitized once a week. And they received all the supplies, they never were short on masks, and they even provided masks for the clients who happened not to have one when they entered the office. We received a serious request for emergency relief assistance, extra funding from our office there, since even though Armenian population is not growing there, people are gradually leaving, but we receive more cases of assistance. We have more families in need, and the number of beneficiaries is growing. It goes quite in contrary with the Armenian population in Lebanon. Number of beneficiaries is growing, and Genesian Memorial Foundation board in the USA approved extra budget for Lebanon.
As you were speaking, I couldn't help but think about medical education. A lot of the programs discussed, whether it be the AMAA, AGBU, Genesian Foundation, Karagosian Foundation, you have healthcare providers there. You have nurses, doctors, pharmacists. What is medical education there like? Do they need more information, continuing medical education that we can do via long distance learning, Skyping, Zooming? Or is there any kind of medical support that we can offer as the Armenian diaspora healthcare providers? it's an open question, and Dr. Kojaglanian might answer too, because you're very familiar with the medical setting there.
Yes, so I must say, Larry, there's more doctors than patients there. So there's definitely, I mean, I'm joking, half serious. Really per population, there is more doctors than they need. So, and in that sense, there is at least 3 medical schools just in Beirut itself. So again, I think from that sense, there is no need. And each of the medical schools is affiliated to either American, obviously, University of Beirut, where we get CMEs, or the French system where they get their credits that way. So from that standpoint, again, let's not forget this has been, as Mr. Zaven said, the hub, and continues to be, because the level of education when you can go to school is at the best really in the Middle East, and continues to be. Although even AUB, which is a 150-year-old institution, is thinking of closing some departments. The situation is that bad. This has never happened in the worst time of war, that it would close departments. And now that's the talk. So clearly it's a new time, but from just regarding specifically to your question, I think the need is much more social, financial, but mostly I hope legal, because I wish there was a way where we can, fight the system and make sure that everything that everybody mentioned is not just forgotten. And I don't know. I wish that we had enough lawyers, enough legal people that can handle the situation more than medical in my opinion.
Very good.
It is really very depressing for someone who grew up there, and I'm sure others on this call share my agony and grief. It's very easy for you guys to speak about it because you are not there, but it's my heart, my home. I don't want to cry right now, but it is very heartbreaking to talk about this. So thank you for everyone helping.
I have a comment, Larry. As we go on, we listen to these institutions, all of them, all these organizations have a lot of history of helping, working, supporting in Lebanon. But what we really need right now in the United States is education, awareness, and vigilancy, because people do not know what's going on in Lebanon. Some are misinformed. Most have no idea what's going on there. So support, fundraising, philanthropy goes hand in hand with awareness. And that awareness is extremely important. We have to be the ambassadors to tell our world in North America, in this part of the world, of what's going on there, what the needs are, because that creates interest, which translates into support, philanthropy. So we need to do that. And this forum in itself is already one of the means, and I think...
Larry, this
yes.
is Ani Hasserjian from Toronto, Canada. I'm a native of Ain Jar, Lebanon. I come from Lebanon as well. So I agree with Solin very much so, that we all feel about our motherland, our homeland, the place where we grew and our childhood was there, and we feel with the people. And today I should say that I'm a proud member of the Armenian Relief Society. I'm a proud member of the Armenian Missionary Association of Canada, which is a sister association of the AMAA. And I'm a board member there, I'm a member there. And I'm very happy that Mr. Zaven Khanjan was there to speak so much elaborately about the organization that I have known about since childhood, and I have benefited from those associations since childhood. And when I was in California, I was an honorary member of the AGBU because I was a member of the theater there. So today I would like to say thank you to all the organizations who work hand in hand to help out Lebanon, Syria, as well as the motherland. And I agree very much so that we have to create awareness around our circles so that the voluntary work is continued and we can help out financially, morally, and in every way. And thank you so much, Larry, for organizing such beneficial town halls so that we can all benefit from it. We will be educated and we can kind of transform it in our circles as well. Thank you for all the panelists today. And Soline, thank you so much. I haven't spoken before, but I should say through all the town halls that I listened, and I was so much motivated of what you shared with us. I commend you for the work that you do. Especially I commend you since you worked throughout. I just started working 2 days ago. I was off all this time because I'm a dentist. I just started working. But throughout the time you were working, the next day you had to be to work, but you were here with us up till 11 o'clock and so on. And I could kind of, looking at you, I could see your inside, your inner emotion, and I share it with you as well. And I commend you, congratulations, and thank you.
And thank you, Ani, as well. You know, it's funny, you get to know people through Zoom. I've known Ani for 10 years, and I had no idea she was so active in so many other groups. But it's so typical. All of us do so many different things in so many different spheres. It's great to know you even better. Dr. Supelian is from Lebanon, and I think he wants to make a comment or two.
Yeah, thank you, Larry, really for organizing this. I know we spoke a little bit about this maybe a week ago, and like Soline, I echo some of the very comments, and you know, sitting here listening to this, it's a difficult town hall where it hits so close to home, where you know both Soline and I, our parents are still back in the Middle East. Most of my family is in Lebanon, and I'm in touch with them on a daily basis. We share, you know, funny memes. We share serious memes. We share serious videos. Some of these anti-Armenian protest videos, which I received earlier today, I shared with Soline and Larry. But I don't want to focus on that. I'd actually like to really commend the organizations that are doing this humanitarian work in Lebanon that are caring for mostly Armenians, but also not only Armenians, others who are in need. Many of my family and family friends are actually employees or volunteers at some of those very organizations in Lebanon, including the Karagözyan Foundation. Irina knows, I don't know if Irina is still there. Several years ago, I actually did a special trip to go and visit some of those very facilities. I have very fond photos and videos of the facilities that are truly, truly impressive, where such activities, such services, and the complexity of the delivery of these services is not seen, in my opinion, anywhere else in the diaspora.
Thank you.
The Hayok Miyuchian's clinic in Burchamut is a 5-story building with an emergency room, an in-house hematology and chemistry lab, imaging center, dental services, pharmacy, where you know you can go there and get an A to Z services. And in fact, when I was there, they were actively recruiting to hire healthcare workers who are refugees from Syria, not only to give services to the needy, but also to provide employment to the needy who had the expertise, who were in the area. The Karagözyan Foundation's multiple facilities, in addition to healthcare, has other community services, the Chinesian Foundation's mental health, especially mental health services that were there for the elderly and families were really, really something extremely impressive. Several years ago, our organization here, the Armenian American Medical Society in California, in fact, allocated all of our fundraised dollars to these organizations, and we equally separated them between the Loch Center, the Karagosian and Chinesian foundations. And Larry, I commend you for organizing this roundtable to show us where, you know, these organizations are giving services to the most needy Armenians potentially anywhere in the world, and doing it in a very complex and organized way where we should learn from them and try to emulate what they're doing. And also, but not to forget that even though, yes, we're focused into our homelands, we're focused to Armenia and Artsakh, but we have other homelands, including Lebanon, including Syria, where, you know, those places have become our homelands, and that we should not forget them.
There were two questions as you were speaking that came to mind. One is, what lessons have we learned in Lebanon that could be applied to Armenia? And the sister question would be to the executive directors who have projects in Armenia as well. Is there something different about the working environments in each country that influence the outcome of your activities?
The Armenian Relief Society has, we have a region in Armenia and Artsakh as well. Yes, it's completely different because I think Armenians are more free to do anything that we like in Lebanon. At least it was for a long time. Now with the political issues, maybe things are changing. But in Armenia, it's completely different. You know, they just got their freedom and we started baby steps, and now it's getting better. You know, there was only financial support, and in Lebanon, they helped Armenia, they helped Syria. Now it's changed. Lebanon needs our support and our assistance.
I think also a big difference between Armenia and Lebanon is, you know, for a number of reasons that we all know, Armenia is starting sort of at a very different place, and there's more opportunities for small enterprises to focus on the socioeconomic development. There's a lot for nonprofits to do in human rights and women's rights. So there's, it almost seems like it's endless programs and initiatives needed in Armenia. That said, I mean, things are changing now in Lebanon as we see. So perhaps a lot of that focus or a lot of those programs and the lessons we've learned with Armenia may have to be applied to Lebanon.
You know, it's interesting when you say it's endless. A lot of times we'll talk about what we can do, and your project all of a sudden morphs into, well, we need to do X, Y, Z, and go through the whole alphabet. It doesn't end. How do we set priorities for what has to be done in Armenia and Lebanon?
I think it kind of goes both ways. On one end, it's a need. The need defines what needs to be done, but that need is kind of restricted in each organization based on their mission. So the need field is great, and it's changing, especially now with political changes and coronavirus and things like that. The need will be, some areas of need will be, but then each organization has its own niche and mission that they have to comply with. So it's kind of being tailored in that sense, I think. And we in history, we have done something that is slightly over and, you know, outside our mission, but that was allocated as emergency relief in special situation. And that happening after Karabakh war, it happened after earthquakes. So this kind of thing has been done that is not exactly within our mission, but they kind of were outreach programs that apply as emergency for emergency situation. The same was, when Syrian crisis happened, we have allocated special fund for Syrian refugees, so different kind of thing. There was legal issues, there was rental issues, something that, have been taken certain place in our budget. So the need is on one end and the mission is, that's how it kind of getting balanced, I think.
Larry,
also working collaboratively with the government and specific ministries has focused a lot of our attention, especially with AGBU, more so with the current government, but even just as an example of the government wanting to focus on IT and making IT one of the top sectors of the country. Well, so very quickly, AGBU that never used to be in IT is thinking, okay, how can we focus our education pillar with an IT spin? Or how can we help attract the diasporan IT professionals into Armenia to help to mentor, or a number of other examples like that. So I think those driven by a lot of what the government is also focusing on is important for our areas of focus for fundraising and support.
Thank you.
Larry, I guess Karen mentioned what I had in mind a little bit. Armenia is a sovereign nation. It has a democratically elected government, represents the people, and so the agenda, the priorities are theirs to set. Each of our organizations have our own missions, so we carry on our own missions continuously. But when it comes to priorities and crises, the difference is that in Armenia, we follow the government, and the government should lead us, and we should follow the government in matching or meeting the priorities. In Lebanon, it's a little different. I think mission takes priority, so we concentrate on our missions definitely and make sure that we fulfill those. But when crises like this come, I guess all these organizations' focus turns to relief, number one. That's sustenance, support, their ability to survive comes first, and then the rest follows.
Thank you. Any other comments? Yes, Eliza.
For Genesian Memorial Foundation, I would like to add that priorities and strategies are decided locally by our advisory boards. So these are the groups that decide and shape the strategy of the programs, and our local advisory boards consist of representatives of Armenian, Apostolic, Catholic, and evangelical denominations. So this is how our program shapes, and I agree with you that Armenia has totally different context, and we can do development programs there, while in Lebanon it's emergency assistance, what dictates the local conditions, and we're a country within a country there, and it's very hard to do development projects in Lebanon, unfortunately.
Right. Well, I admire all your organizations. You're doing such good work, so many different ways in different countries. I don't know how you all keep track of everything that you do, but we certainly appreciate it. I think a newfound awareness, at least on my part, of what's happening on a micro level in Lebanon is really very, very helpful. And let's try to spread we're going to finish by hearing a little bit about what's happening in Armenia. When we started Armenia 14 weeks ago, we had a lot of confidence. Things were going very well. Unfortunately, there has been a sudden spike in cases. 2 weeks ago, there was 8,200 cases. Now there's over 14,000 cases, close to 15,000. The number of deaths, unfortunately, has increased from 2 weeks ago, 113 to 245. There are about 500 Armenian citizens, unfortunately, in the intensive care unit. which really doesn't bode well with the mortality rate, given not the treatment. They're getting excellent treatment, state-of-the-art treatment, but the disease itself is not great. Dr. Akinian, can you share with us some of your thoughts on what's happening?
I am sharing a slide, Larry. Do you see that slide?
Yes, you're doing very well.
Yes, we see it.
Okay, so it's 10:58 p.m. and we already had a wonderful, incredible panel about Lebanon, and I'm so grateful that this panel took place, because it's not all about Armenia or even the local community. But let me just take 2 minutes to show you this very important slide, because it's a harbinger of things to come in those communities that open up too quickly without enforcement and regulation in place to have to enforce social distancing. So I want to just take you through this slide, and I think that's enough for this evening. And the slide starts on the left with the very first positive case tested in Armenia, somebody who had come in from Iran, an Armenian citizen who returned from Iran, was the first positive case in March. And I just think it's really important for you. I don't know if you can, I don't think you can see the dates in this photo, but hopefully you can see the text. And what you see is I put one of these, this was, by the way, put together by Aras Chiloyan, a recent MPH graduate at Boston University. So I don't know if you remember from the news, an Echmiadzin cluster. I'm sorry that this slide, the photograph is cut off at the bottom for the dates, but that's in March. And we see that there was a woman who was positive, who went to a engagement party with 200 people in Echmiadzin. And from there grew a cluster from there. And then there was the state of emergency was declared on March 15th. Again, I apologize, the dates do not come out on this slide the way that I'm displaying it. So state of emergency declared March 15th. And you can see that after the state of emergency was declared, while cases go up on the scale on the left, you see that daily cases confirmed are at about 100, underneath 100. And on the next text is the number of restrictions and movement and economic activity was lifted. So there was some easing of the economy on April 22nd. That's that line. And then the next text is the end of the lockdown, which is on May 4th. So as economic activity was restricted, there was increasing cases, but still rather controllable and fit within the capacity of the healthcare system and the testing availabilities. But after the end of the lockdown, which was on May 4th, so that's that second to last text line on this slide, from the end of the lockdown, you count 14 days and you see a significant increase. Don't forget how contagious this virus is. For every person who is infected, they can affect another 2 or 3 people, and then those 2 or 3 people infect 2 or 3 more, and so on, right? So then we see where the government has started much more activity in the area of enforcement of social distancing. They made compulsory face masks 2 weeks ago, and what we're seeing for these increased cases are really, in fact, cases before this latest enforcement, exposures, before this latest enforcement. And so I think that's enough for this evening. Many of you follow the news in Armenia. It is a very good case example of where entering into the economy or stopping the shelter-in-place policies where there is not an enforcement arm for social distancing, particularly in enforcing the regulation about not having social gatherings. There are a number of clusters in Armenia that have occurred as a result of funerals and weddings and things like that. So it's a harbinger of things to come in other places that open up quickly, including our own communities here in North America.
Well, the purposes of these meetings is to give people the evidence from the experts, so we as leaders can make the most informed decisions with the best information we have at the time. And the reason we keep on doing it is because the information is changing every week, every day. And just when you know everything you need to know, it changes tomorrow. So it's an ever-changing field. But I want to thank everybody. Again, I want to thank our panelists, our speakers. It was just a wonderful conversations that we had tonight. And I look forward to seeing you all next week. And if you have ideas for additional speakers or any way to improve the program, or have friends you want us to join with us, please, by all means, contact us.